Well, good evening, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And I have a co-host here today.
My name is Sue Wallace, and I'm a certified senior advisor, and I do advocacy with folks all the time.
And tonight we have a very special guest. We have Attorney Bradley Schwartz. He is with Greater National Advocates. So I'm going to have him say hi and tell us a little bit about yourself, Mr. Schwartz.
Hello, everybody. How are you?
Great, great. So tell us a little bit about who is Bradley Schwartz.
Well, I am an attorney in Chicago, but I find my main role these days is trying to connect people with advocacy help when they need it through a website, a nonprofit website called Greater National Advocates, and that's designed specifically to make sure that the word gets out about what patient advocacy is, independent patient advocacy, and how to connect with one. And the reason that I do it is kind of personal, because nobody wakes up one day and says, boy, I want to start a independent patient advocacy website. It doesn't really always work that way. For me, like so many other people, I became the victim of horrific medical error as a result of medical miscommunication. Everything that could go wrong did go wrong for me when I went to the emergency room back in 2004. I had a really bad headache, wasn't getting any better. It was a holiday weekend. I arrived. It seemed a little disorganized. People weren't really talking. I had friends and family with me, 7 people all together. And I waited in the ER for 8 to 10 hours without really getting any care, treatment, attention whatsoever. During that period of time, everything just got progressively worse until I got shipped off to ICU and put into a coma, put on life-saving support for a month. And I woke up to learn that I was going to lose all 4 of my limbs, which I did. And that was pretty much the impetus for me starting Greater National Advocates. I mean, after investigating and litigating, contemplating, I came to the conclusion that if I would have had somebody with me in the hospital to make sure that signals didn't get crossed, warning signs didn't get missed, lab results were actually looked at, things like that, pulling everybody together, I probably would not have had such a horrific outcome. So in a nutshell, that's who I am, and that's what I do, and that's why I do it. GNA, Greater National Advocates, has been around for a couple of years. We're already huge. I think we're the most visible directory for independent patient advocates in the USA. We get a lot of traffic, and we do everything that we can to promote the profession and the advocates that are listed on our site to an audience that desperately needs to know about advocacy. And I'm not only talking about the patients and families, I am also talking about the hospitals, the institutions, the people that work there, and all the advocates out there who really should be practicing advocacy, but they don't even know about it. So this is kind of like a 3-pronged mission that I'm on right now.
A lot of work to do.
Oh, yeah, a lot of work to do.
Well, first of all, I commend you. I admire you. I respect you. And I'm so honored to have you here on my podcast channel.
Well, thank you. I mean, we've been talking about this since Houston, right?
Yes.
I'm delighted to know about it. This is so exciting, because I have just been, very recently, I have been an advocate to a woman in the hospital that could not speak for herself at all.
Right.
And I had so many nurses come to me and tell me how much help I had been to them, and also what a difference I made. And that lady was so lucky to have an advocate for herself. And so it's, it's really real to me. And I've known that for a long time, that people just, when they're placed in especially a health situation, they need an advocate. And, anybody in the hospital needs an advocate, whether it's family or who it is. So
It doesn't, I mean, you could be the chief of staff at the hospital
that's
that you
right.
go to. The minute you walk in there and put that robe on, you are just another helpless patient who can't even speak for themselves.
That's absolutely correct. And there's so many people that need what you have to offer. So I also commend you for all the work you've done. 2 years and you're the largest advocate.
I mean, I don't know. I feel like we are. I know what kind of traffic we get. I know how many people we help. I answer the phone all day long. I'm always connecting people with advocates. I hear those same types of stories that you do. It's just knowing that it works. But no, I think that we're probably the most visible, and we do a ton of outreach, which is, look, let's be real here. This is a small world. And, I think all of the advocacy organizations that serve and cater to the independent patient advocacy profession, I think everybody is starting to realize that, we are stronger together. The more we work together, the more we can accomplish. And, that's why, there's a big concentration amongst ourselves right now to concentrate on what it is that we're good at as an organization, because it's just like anything else. If you try and do too much of anything, you're never going to be exceptional at one thing. And we at GNA, we just want to be exceptional at one thing, and that is promoting the industry and making that connection with the public that needs an advocate. So we focus on that. And relying on all these other organizations to do all of their fantastic work of training, certifying, teaching advocates how to actually run a business. Those are all critical. And we would not be able to do anything with Greater National Advocates if it hadn't been for any of these other organizations. I'm talking about AFA, Advo Connection, the PAC Board, NAHAC, all these groups. We're all realizing that there's strength in unity, strength in numbers, and I think this is going to be a really good year for the entire profession.
I know it is. I know it is. We're trying to make this a household name.
Hey, yep, it's one of my taglines. Yep.
Absolutely. And your story is so powerful because, other people would have given up. They would have, thrown in the towel and went to a world of depression and misery, which I'm quite sure you superseded all that.
No, you have to go through all that stuff.
Yeah.
I didn't come out of the hospital with no limbs and a big smile on my face.
Exactly. So your testimony is so powerful because you took your testimony and you are helping so many people. That three-prong that you talk about. You're helping patients, you're helping advocates, you're helping the organization itself. It's wonderful what you're doing. It's great. Yeah. So you have any questions?
Well, I'm sure I have a million questions, but so tell me, why don't you tell me a little bit, because I don't know the different organizations. They sound powerful that you work with. And
okay, well, like I said, we'll start in the beginning. And in the beginning was probably, depending on who you ask, I'd say, 2008, 2009 or so, when people really started to self-identify as patient advocates. And at the time, there were people who were leaving nursing and leaving social work and deciding that, these are pioneers who got fed up with the system before everybody was talking about how horrific it really was. And they went off and started this field in different areas. And they organized. And the first organization, I believe, was the National Association of Healthcare Advocacy Consultants. They're still around. They're a leading force in terms of, making sure that advocates are represented. I served on the board of directors of that organization. And there are other organizations like the Alliance of Professional Healthcare Advocates, another great resource where advocates are provided with all the materials that they need to actually learn how to conduct this profession, learn how to do do's and don'ts, and understand the business of patient advocacy, and how to present yourself in a business situation, and actually how to make a living off of it.
Right.
Then there is the Patient Advocacy Certification Board, which is a very important group because frankly, we wouldn't be anywhere without certification. And, I served on the Patient Advocate Certification Board as well. And that's what I was saying earlier. All of these organizations gave me the insight and the knowledge to understand that there was a lane for greater national advocates. I didn't want to credential. I don't want to train. I don't want to teach. I want to make advocacy available to people, make it easy to find an advocate so that they can get immediate help, so that something like what happened to me doesn't happen to them. But I can't do it alone, and I don't do it alone. So these groups are very, very important to the entire, let's call it the ecosystem of independent patient advocacy.
Yeah.
And really, Bradley, you did that rather quickly. You said that your hospitalization was in 2004, and then by 2009, you had formed this organization.
By 2009, 2010, I was starting to learn about it. Then after learning about it, investigating it, getting totally enamored and impressed by it, that's when I started serving on the boards of directors and started a local group that eventually evolved into Greater National Advocates. And Greater National Advocates actually went live as an entity about 2 years ago.
Oh, okay.
So yeah.
Yeah, so I was telling Sue that what happened with my career, or my chosen advocacy path, was you find out about one organization and then they say you should find out about this one, and it just builds.
Yeah.
And for me, the collaboration and the camaraderie is for us to stand together as a industry. It's not about one lane, it's all different pieces of a puzzle that you can put together. You can get different resources and they all come together.
Right. And we saw that personally firsthand, from the other side when we went down to Houston. I mean, there are good-hearted, well-intentioned people who are willing to, serve patients and use their knowledge and skills and experience and connections to serve patients. And not all of them are coming from hospitals right now. I mean, we went to a health advocacy conference,
Right.
Deirdre and I, in Houston, that was pretty much funded by Big Pharma, but they were doing it the right way, don't you think?
I think so, but the only thing, I love the relationships that I met people and got to see a different side, but I'll say it, I really wanted us to have a lane as private patient advocates, because not many people know about private patient advocates. So that's why what you're doing is so important, to increase the awareness of what is a private patient advocate and how can we work with the patient advocates that are behind Big Pharma, behind the hospital, behind the other organizations.
Yep. So yeah.
Yeah.
We share names because we're kind of think we're doing the same thing, but if we could, put our heads together, we can really get things done.
Absolutely. Absolutely.
That is so true. It's it's just working with, whatever the situation is, and I was telling Deidre that sometimes the client that I have right now, she really relates to me more than she does her own family, because I'm the person that's helping her. Okay. I mean, that's the face she sees. And so that's so important, because you have to, bring the family in as appropriate and things like that. So it's just knowing discernment, as you said, to know exactly what to do next, because every situation is so different.
Right.
But we can learn from one another, so it helps so much. This will help me a lot.
And to me, it's so powerful as a patient advocate. I know what my specialty is. So I know to reach out to other patient advocates that may need, that if my client needs something that I am not specializing in, I have no problem reaching out to another advocate and saying, hey, I need your help navigating insurance, because that's not what I do.
Right, yeah. I mean, yeah, these problems, you know, they go hand in hand. Good luck finding somebody with a medical problem that isn't going to experience a billing issue to go along with it. I mean,
Right,
they
absolutely.
seem to be tied to each other.
Yes,
That's
yes.
true.
So Bradley, you're basically your target audience is nearly anyone who's involved in healthcare, whether they are.
I'm trying to wake up the nation to the life-saving benefits of independent patient advocacy. And when I say wake up the nation, you're right. There's a lot of people in that nation, and there are a lot of different groups and organizations that need to be made aware. So.
And I love networking. It is work for me all the years that I started the first personal assistance company.
I want to hear a little bit more about your history, if I may. You know, tell me how you got started. Tell me, you know.
Well, actually, I started the first. God just picked me. I was not a social worker. I was not a nurse, but it was laid on my heart to help people in their home provide services, and so I started it with myself. And it just grew, and I had that company for 26 years.
Wow.
In 2006, I heard about this organization. It was called Certified Senior Advisor. And I thought, you know, maybe I better check that out, because I'd been giving advice for a long time to folks, and I wanted to make sure I really knew what I knew, you know, kind of thing. And so anyway, then I became a CSA, and I did that as part of my company, you know, the offering for my company. And then in May of this year, I decided I would do it full time. So, and because I just love it, because I love to help people. And that's what advocacy is. It's just whatever they're going through, you know, so.
No, and, you know, I've always, you know, I love what you do. And you know, we have a lot of certified senior advisors, geriatric care managers, all these different names. You know, we're all advocates, but, you know, for example, CSAs, I mean, they define themselves as pretty much advocates that are serving a population of seniors and elderly, but we're doing the same work. Same thing with a lot of the folks in, you know, cancer and rare disease. They're advocates for a specific targeted audience, a targeted group of patients and loved ones. I'm trying to cast a broad net, and include people like you and the CSAs and the case managers and the RN patient advocates and the nurse advocates and the health coaches and the wellness professionals and the integrative and holistic and complementary medicine people. Everybody that has something to offer from a healthcare perspective, I think, should be easily found and be in a position to collaborate with other people.
That's right. Absolutely.
Right. It's about building your village. That's right.
Yes, really is. So I'm trying to build a virtual one. So I welcome you. CSAs are huge and important. So I expect to see you soon.
But you were not. They were. I've talked about it for quite a while, and now there's a few here. But when I went to the live class, I was the only person in healthcare, and it was over 200 people in that class.
Where are they coming from?
So they were mostly insurance, investment, you know, type financial things. So I was kind of odd. I was the odd girl there, you know, but I told them a lot, you know, I told them a lot about healthcare. And now we do have several that that have become CSAs that are running like senior centers and things like that, which is great because they can advocate so much for a number of people. And so I've done what I can, but I personally just love to be involved with the clients and their families and help them through, like I say, whatever it is that they're going through. Sometimes it's difficult. It's difficult situations, and you bring other disciplines in to help you, as far as the healthcare. So I know a lot of people in the 26, about 30 years I've been doing this now. So I know a lot of different people from different networking groups that need to know about advocacy also. So anyway, so we can get the word out in this area for sure. So I'm delighted to meet you.
So I would say that anybody who is thinking about being a patient advocate, or if you're a patient or a loved one of a patient, go to Bradley's website. It is well worth it. You have some educational stuff on there too.
We promote and we partner with many organizations, and if it's a good event that's going to provide some benefit to the patient and family community or to the advocacy community, we're going to get behind it. So it may look like we put on a lot of events on our own. No, we just get behind them and support them. So that's pretty much what we do.
Wow, educational platform, networking platform, resource platform.
Yep.
So if someone wanted to find out more about your organization, Greater National Advocates, what is the best ways that they can reach out and find out more?
Well, the best way to find out anything about Greater National Advocates is just to go there. And you're going to want to go to GNANOW.org, and it'll take you right to Greater National Advocates, and you're going to see right off the bat how it is that we promote the concept of independent patient advocacy to the public. And then if you're an advocate, or if you're a would-be or a could-be or a wannabe advocate, there is a place for advocates to take a look around and become listed on the directory so that your services can be made available to patients and families that need you. And that's what we do. We promote the profession and we promote the services of the individual advocates and give them stuff to do while they're there. I mean, you don't have to get listed. You could write blogs that we publish all over the place, all kinds of stuff that we do to actually, spread the word, because, I've just found it's really hard sometimes to walk in somewhere and sell yourself. I think it's sometimes a little bit easier and almost sometimes a little bit more credible when you have other people that are saying, hey, I'm behind this and I'm with this, which is why it's so great to be on a program like this, because you guys are making it real easy. You are going to go tell all your friends and all your organizations, everybody, that you got to go to GNANOW.org right now. What are you waiting for? No, seriously. Seriously, it is hard to get people to commit to something like this. It's free, and we're doing it without, we're never going to charge anybody a dime to be listed on Greater National Advocates, and we're going to never charge patients or families to use our services. So I want to give this away, and I want to make it available to everybody. So.
Oh, well, I
think. And then, because of our partnerships with all these other organizations, it's like once you're in, you get trained, you meet other people, you get certified, you get, you learn everything. So, but if you got skills, if you've been there, you've been through something, and you could offer that assistance to somebody else, and you've done it for friends and family,
you can do it.
No reason to hold back.
Right.
Try to help other people out.
And we know how many people need those advocates in a healthcare situation, hospitals. I was recently in a hospital with a client for a long time, and the nurses told me there are so many people on this floor that need somebody like you. Okay. Yeah. So it's out there, and we just need to make sure there's enough people that know about it that can help people that are in need. So I thank you so much. This has been wonderful. Deidre, thank you for allowing me to co-host with you tonight. This was a real.
I've seen you. You've co-hosted before.
Yes. So he watches.
I have co-hosted before, but this was a real treat to get.
All right. Well, I'm really glad. Let's not. We can get real fun and do some other good fun topics and stuff down the road too. I'm glad I got to do the introduction and everything. I love doing this sort of thing. But yeah, this was great. And thank you so much for having me and for making room for me and for allowing me to speak about Greater National Advocates and to kind of hopefully convince some people to get on board.
Right. Thank you.
Well, thank you.
All right, guys.
And
All
thank you everyone for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities and nation. So tune in next week for another amazing guest. Thank you, Attorney Schwartz.